Good afternoon, everyone. My name is Kathy Kennett, and I'm Senior Vice President of Clinical Care with Parent Project Muscular Dystrophy. PPMD is incredibly excited to be able to present the first in our series of webinars addressing caring for caregivers. We all know that a diagnosis of Duchenne affects the whole family, and deepening our understanding of how the health of the family is impacted by this diagnosis will only help us to develop more useful resources for the community. We're very happy to have joining us Dr. Kendra Bueracher, who is a neuropsychologist with specialized training and expertise in rare genetic diseases. Dr. Bueracher served as the neuropsychologist for the neuromuscular, neurogenetic, and neurometabolic clinics while on faculty at the University of Minnesota and the Children's Hospital Colorado at the University of Colorado. Dr. Bueracher is located now in Minnesota, Minneapolis, with her own consulting business called 3-to-1 Neuropsychology Consultants, PLLC. Her mission is to disseminate information for rare disease awareness and quality of life, consult on medical and education issues, present at conferences, seminars, and family meetings, and consult on neurocognitive and behavioral outcomes for natural history studies and clinical trials. Well, this webinar is being sponsored by Sarepta Therapeutics. The content presented in this webinar is the independent work of Dr. Bueracher. As a bit of housekeeping before we get started, you are all on mute. If you have questions, please feel free to type them in the box on your screen. We'll try to wait to answer all the questions at the end of the webinar, but if it looks like there's some confusion, then we'll stop and introduce or entertain the questions in advance of the end of the webinar. So with that, I'd like to turn it over to Dr. Bueracher, and we're incredibly happy to have you, Kendra.
Thank you very much. That was a wonderful introduction, and I would like to thank PPMD and thank Sarepta Therapeutics for this wonderful opportunity presenting the first in Caring for the Caregiver webinar. But most of all, I want to thank you, the listeners, for allowing me to be part of your life for an hour. I know that you could be doing many things with this hour, and just by taking a small short break here, I really appreciate it and understand the sacrifice that it can make when you're caring for a child with rare genetic muscular disease. So thank you very, very much. This is the first, and we're going to begin to just peel back the layers of the complexity of caring for a child or an adult with either Becker or Duchenne, and what that might look like, and embrace the complexity of what caring for a child is like, and all of the aspects and the dichotomy of doing that. And hopefully, step by step, each step will lead to a new discovery for you, and maybe a new discovery for your child as well. Before I begin, I want to say that each of you who are listening are in a unique position. And so you're all on a continuum, whether you've just received the diagnosis or you have lived with the diagnosis for a long time. Each of you are on a continuum. I respect that, and hopefully that some of the questions will get answered, but maybe more questions will come up that will need to be answered for you. I just also wanted to say that by way of personal experience, I have dipped my toes into the waters of caregiving, if you will. Losing my son 11 years ago, it's not the same. I know that. It was only a short illness, about 3 years. I also care for a special needs adult stepchild. And so we can all have this experience, but it's not the same. And so we each bring our own definition to the table, and we each bring our own experience to the table as well. Today we're going to discuss who are caregivers and what do they do, the impact of caregiving on physical and mental health, and effective interventions for caregiving. A caregiver is really any relative, a partner, friend, or neighbor who takes care or assists in taking care and providing a broad range of services to an adult or somebody living with a chronic or disabling condition. Rosalind Carter said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And it is so true that we do fall into one of those 4 groups of people. So in preparing for this, I've compiled many slides, and I won't belabor you with them, but I'm going to highlight some of what the literature says about parents' experience raising a child with not only a chronic condition, but specifically with a muscular dystrophy such as Becker and Duchenne. So caring for a child with a long-term condition can result in challenges. As you know, just raising a child without any complex medical need or any type of special need is a challenge. It's exhausting. But then you find out that your child has Duchenne or Becker, and it just makes it even more complex. Because of the disease-specific demands, such as maintaining all of their care and their treatment, keeping up with the language of it, social and financial constraints, and maintaining family relationships. All of you, when you have your child, you didn't have any vocabulary that related to Duchenne or Becker, and your psyche didn't even know what to do with that when you got the diagnosis. And you knew that something may have been amiss when you were watching your child develop. And then you get the diagnosis, and all of a sudden you have to build this shelf in your mind that says, okay, Duchenne, okay, my child has Becker. What do I do with this? How do I deal with this? And the first thing that parents do is they Google it. But that is natural, and the more that you hear webinars and the more that you get connected and the more that you have social support, that shelf becomes built. And then you begin building other shelves in your mind that involve support and coping and relationships. And all of a sudden you have bookcases in your shelf, and it becomes more part of your life. And so that's the continuum that many of you are on, the Odyssey. There were 34 studies reviewed to describe and summarize parents' accounts of living and caring for children with long-term conditions. Not specifically Duchenne in this particular one, but all chronic conditions. The conclusions came up with 3 themes. One was parental impact, illness management, and social context. So theme 1 was parental impact. There was a lot of huge range of emotions that parents experience when they receive the diagnosis of whatever their child had. They experience confusion, disbelief, anxiety, turmoil, loss of identity. But the emotions, interestingly enough, dissipated as the parents begin to accept the reality of the situation and focus on meeting their child's needs. And I think this is true for receiving a diagnosis in general. When you first get the diagnosis, you are confused. You do have a sense of disbelief because you're going through a grieving process. And then once often when those emotions are dealt with, then they begin to dissipate as you begin to learn more about the disease. For some, a more enduring grief referred to as chronic sorrow evolved. so results in the inability to retain information. So the sorrow, that chronic sorrow, put up a barrier by which it kept information from coming in, and parents were continually searching for reasons for their child's condition and feelings of self-blame. And then adaptation and coping was identified as really an important feature that the parents wanted to express. Parent adjustment appeared to be dynamic, so it's always changing because of the ongoing changes in the child's condition and the stage of development. Most parents in all of these 34 studies reported that they adapted and they coped and they gained control by really focusing on the child's achievements and performing the care routines, which strengthened the parent-child attachment. Some described being physically and emotionally overburdened, which manifested in chronic fatigue and frustration and feeling emotionally drained and challenged, particularly when it was physically demanding. And I often remember times caring for my son where the chronic fatigue was numbing. And really when people are chronically fatigued, then assimilating information does become very difficult. And then caring roles dominated parents' roles. What this is saying is that when you become a caregiver of a child with Duchenne or Becker, what happens is that role becomes dominating, and the role of maybe become that you're a daughter, that you're an aunt, that you're a wife, that you're a mother of other children as well, don't always become the dominating drive because you have a child with so many needs. Out of all the years that I've been working with parents and children of complex genetic diseases, isolation with really few social outlets came to the forefront of most studies, not only in studies of chronic conditions and quality of life, but this type of study as well, caregiving and caring for a child with Duchenne or Becker. Mothers experience the greatest role change because if they were in a career and then gave up that career, this may have impacted their aspirations to move forward with that. Fathers perceive their role as family provider and protector, and they were really burdened and challenged by the money pressures and the loss of control. Interesting enough, whenever families would come in to see me, this is something that I did. Because of the way men and women are wired, and this isn't really, it's a generalization, and so I know that there's fathers that don't do this, but oftentimes fathers feel like they have to fix something, and this is one thing that they can't fix, so they feel some loss of control on that. And by doing that, they take control of other things. Maybe they'll go out and buy something, or they'll do something so that they can control it because that's their way of fixing things, where mothers tend to really get involved in the family's life. But on the same token, in contrast, this research said these experiences provided opportunities for really strong personal development, such as communication skills, organization skills as well. Theme 2 is illness management, which, and speaking to the experts here, all those who are listening, really it's providing and knowing about the condition and what treatment. Learning the symptoms and how to recognize, is that a symptom of Duchenne or is that a symptom of Becker, or is this something else? To develop effective relationships with healthcare professionals and providers. So get that network. How do I get that network? It said that the information that the parents wanted were about the disease and about the treatments and how to access services and support networks. Who do I go to? What do I need to know? Give me resources that I can utilize quickly, strategies that would help them to cope. Parents described difficulties in obtaining that information. They felt like it took a long time to figure out what they needed to do. And then it was overrun by medical jargon and insufficient or inaccurate, unclear information. And you know why that is? Because you're the expert. You have learned about Duchenne and Becker to the point that you know more than anyone. And so when you go to a doctor and they don't know a whole lot about it, it's really insufficient or inaccurate. You wanted information quickly, and doctors gave you that information, but it was so quick, and you didn't have an opportunity to discuss that information, and an inappropriate timing of the information. So we're all ready to receive information at a particular time. I was, you are, your friends are. And sometimes the timing just wasn't appropriate, and that could be open to discussion as well. Parents developed really an expertise in managing. They want and desire the need for collaboration. Parent satisfaction with health professionals was variable. They identified communicating with professionals, all kinds of professionals, as being stressful. Relationships built on mutual respect and trust endured over time, though. So when they found the team that they needed, they kept the team, and they developed a really strong relationship with that team. The third thing that came out of the research was social context. Family life disrupted due to unpredictability of the child's condition and therapies and appointments. So planning for an outing, or planning to see the football game or the baseball game, or going to your daughter's events at school, or things like that, could be disrupted by your child with Duchenne or Becker's conditions and appointments. Parents worked hard, really hard. I can see it every day that they work very hard at creating a normal family environment. They have a positive outlook, shared responsibility for caring routines, and they're really very proactive. Family relationships were noted as being strained if they didn't have time to spend alone. In contrast, some studies reported parents' relationship strengthened due to mutual commitment. So they were very committed, which brought them together. Highlighted in all of the studies were social support networks were very, very important. Here's some more recent research, which is disease-specific. So it's specific to Duchenne, Becker, muscular dystrophy. This one came out not too long ago, last year, and I'd like you to notice the authors of this: Psychosocial Needs and Facilitators of Mothers Caring for Children. A lot of information. All I want you to do is take a deep breath. I'm going to highlight some of the research here, but you'll have it for your own use, and you can go back and refer to it as well. Very good paper on identifying some of those triggers or targets for interventions to improve the psychological well-being of mothers caring for Duchenne, Becker, muscular dystrophy. We know that caregivers at any level are at a high risk for depression and stress-related illnesses. This paper really wanted to analyze the psychosocial coping needs, respite care needs, and care facilitator needs. They also explored maybe there's some correlation or there's some tie between the mother's psychosocial and respite needs and really the progression, where the child is and how the child's progressed and their ambulation status. So they hypothesized, which is just a quick guess, they're guessing that the more the child was unable to ambulate, the greater the needs would be for the mother. They looked at 3 unmet psychosocial needs, specific ways to deal with uncertainty about the future, how to manage fears related to Duchenne, Becker, muscular dystrophy, and ability to cope with being a mother of a child with DBMD. They had open-ended questions like, right now, is there one particular thing about DBMD that makes it most difficult for you to care for your child? And here's what they came up with. The 4 themes that comprised unmet needs were to access barriers. They want information. They want to be able to get to where they're going. They wanted information at their hand. They wanted to know what to do first, second, third. The physical demands of caregiving, the negative effects of the behavior or psychological issues. They described their unmet psychosocial needs as being really uncertain about the future, bearing witness to the progression, the disease progression, and helping their son deal with their progressing illness. So those were some of the things that they were looking at. Open-ended responses reinforce the importance of managing the negative feelings. But contrary, this is interesting, contrary to what they were guessing, higher psychosocial support needs were associated with earlier, less disease. And I think it has to do with, remember I said we're all on a spectrum and we all receive information differently, and we're all building that shelf where we put the diagnosis on. They felt less support at the beginning, and really their coping strategies got better as time went on. So they were better equipped to cope with the diagnosis using their internal, so their coping skills, the way that they manage, and external resources, so the information that they get from either friends or clinic or relatives or PPMD, other resources that they can log into. Participants identified areas of caregiving strength. So support from a partner and family member was important in their approach to life. As a psychologist, I know that your coping skills as a child and your coping skills as a teenager, your coping skills as a young adult, actually play into effect as you grow older. You tend to rely a lot on some of those learned coping skills. More than half, over 50% of the respondents endorsed faith or spiritual beliefs and support from healthcare providers as care facilitators. So those facilitators are people who help. Open-ended comments highlighted the need and the importance of exercising, social support, and taking time out for pleasurable activities as important components of self-care. These facilitators provide important targets for intervention. And one of the highlights of this article, which I found very interesting, was you have to start early. Just start as young as you can with some of these interventions. So, and even with coping and uncertainty, they know that the earlier that you start, the better you will cope later on. With regard to respite care, clinicians should anticipate that mothers may worry about allowing their children to be cared for by someone else, and support those mothers in some way of achieving that comfort level. And so, very interesting study, and I encourage you all to read that. The next study came out prior to that, and it pretty much said the same thing, although it said resilience is a multidimensional personal attribute that may be shaped by personality traits. That's what I was mentioning before. All of us are born with a temperament and personality traits. We come into a family that forms some of those personality traits and temperament. Evolving appraisals, what do we really say to ourselves in time of need? Social support systems and family environments. A resistance to adversity that has been demonstrated to influence positive outcomes after a stressful event. So, protective personal and social resources. They pretty much said they're, again, This was an earlier study. They were looking to see if the coping ability of these parents was progressed as their child progressed in the disease, and the coping strategies begin to become weaker, but they did not, and that was interesting. So DMD-focused psychological outcomes, the emerging field of positive psychology, which is a real interest of mine. It comes out of Pandora's positive psychology, and it's about resilience and how do we form that, and self-efficacy. How do we form that? And I think what's happening in some of these studies is that they're showing that the more you are successful at raising your sons with Duchenne or Becker, the better off you are and the more resilient you become because you have successes and in dealing with some of this adversity. Overall results suggest that clinical and psychosocial interventions can highlight strengths and well-being rather than burden and deficit as well. So the effects of caregiving. You don't have to pick up a paper or open up any type of website, and you will find several health, stress-related illnesses related to caregiving. Because of the aspects of caregiving, there's three things that you have to look at. The duty of caring, which involves all the legal terms, not only medically legal, but education, everything that you have to know about social norms that have to do with duty of caring. And I know that as quality of life, one of the number one determinants of poor quality of life is having to deal with insurance companies and things like that, having to learn that very quickly. Also caring for, which implies the needs of the tasks that you have to do to attend to your child. And then caring about involves concern of the self-image and the psychological well-being of care receivers. So there's really three components to that. Every piece of research, so this has been adapted by many of the research papers that I have read, all sorts of resources. There are common signs that stress may be affecting your physical and emotional health. Before I go on, I just want to say again that I honor you as parents of boys with Duchenne and Becker, and I am here to give you information. I am here to just pull back the first layer, the very first layer of maybe looking at these, and maybe you're not ready to look at these, but you can take this home with you and think about it. But most of the research does say that there could be some stress that affects your physical and emotional health. Physically, you can read some of these. The fatigue, the headache, the stomach problems, and disturbed sleep is huge. But also what's interesting is when your child is in pain, and that pain is untreated, it leads to behavioral issues for you. And sometimes, when you can't get your child from feeling so much pain, that causes a lot of stress. Also, caregivers tend to hurt themselves because they're providing services they're not trained to do, lifting, kneeling, carrying heavy equipment, and they begin to have back problems due to that lack of training. And then emotionally, it's an emotional roller coaster. You demonstrate love, commitment, rewarding of personal experiences. But on the same hand, it's kind of like a cognitive dissonance. On the one hand, you have all the love and the commitment rewards, and on the other hand, you have exhaustion and worry and inadequate resources, which cause huge amounts of frustration and continuous care demands, which are stressful. So these confusions and difficulties lead to some of these issues with disturbed sleep and fatigue and the headaches as well. So those are true and can be looked at in ways that can provide intervention. So feelings often expressed by caregivers, but they don't share them, are fear that you can't handle the situation, of what other people are saying about how the situation is being handled. If something is happening to me, embarrassment, some of the depression that comes along with it, some of the anger, and anger too, because you need help at times, and that help isn't consistent. I know in my life, when somebody said, well, I can come over and watch for an hour or something, and then they never showed up. It's the consistent help that is very important. And when that doesn't happen, some of these feelings come in. So worry that they may later feel they didn't give enough. And mothers, I tell you what, we worry a lot about that. Shame that you're failing other people in the family, feeling helpless because you don't know where to turn, and sometimes the guilt, did I do enough, what can I do, and grief. And grief is something that we really need to look at and explain in a way that people can understand. So caregiver help is very important, and I can't stress this enough. Coming from someone who has done some caregiving, not stress this enough. So let's just take a deep breath. We're going to dive right into caregiver help, because this is what we need. We need to decrease our stressors. We need to recognize what our stressors are. Sometimes we need to say to ourselves and alter our appraisals. We need to think, okay, I know that this issue has come up, but I need to maybe reword it in a different way. We need to build on internal resources, like we were talking about, some of the spiritual, the self-efficacy, the thoughts that we tell ourselves, the emotions that we tell ourselves, the behaviors that we model, the behaviors that we watch. We need to build those internal resources. And then we need to rally and provide external resources. We need to come up with a team of people and loved ones and healthcare providers that can rally around us during these times. You can't stop the impact of chronic or progressive illness on someone for whom you care, but there's a great deal that you can do for your personal well-being. And I know this probably, when you're in the thick of things, this is really hard to even tell yourself, but it's so true that you have to take care of yourself to be able to take care of anyone else. There's common types of interventions. This is intended not to be exhaustive. It's just illustrative. Educationally, we can teach caregivers information and skills to manage. So I think, it would be wonderful to have, some of these workshops DBMD puts on and things like that to teach the new parents coming up information and skills that are needed. So they're more active participation versus information only. People want to be active. They want to be shown instead of just information. Support, unstructured emphasis, support from members or just other parents who are dealing with this. Or you can get structured from associations or some of the other places that you can get support that are really structured. Individual intervention, so cognitive behavioral therapy with a focus on your emotions and how you react to those emotions and being taught how to do this. But again, that takes time, and I know that time is really precious. It's a commodity. And then family interventions, respite for professionals or family members that can come and try to help out as well, but that has to be consistent. Here are just some tools that may help. It's adapted from the Family Caregiver Alliance. As I mentioned before, reducing your personal stress, how we perceive and respond to an event, and how we adjust and cope with it. Stress you feel is not only the result of your caregiving situation, but also the result of your perception of it. Your level of stress is influenced by many factors, whether it's voluntary, if you feel like you have no choice, changes are greater, if you feel you don't have a choice. Your emotions, you will feel more strain and distress and resentment. Your relationship with the care recipient is extremely important. That needs to be looked at as well. So again, we're talking about levels of stress that can be influenced by many things. Your perception, your relationship with the care recipient, your coping ability. Again, I mentioned this before, how you cope with stress in the past really does predict how you cope now. And so some of those things can be tweaked. Your caregiver situation as well. When you look at some of the situations can be more stressful than others. So like I was saying before, if you are unable to ease the physical or emotional pain of your loved one, that really increases the stress in the situation. Or whether or not support is available, or even somebody that you can pick up the phone and talk to. So recognizing the warning signs early, I think this is really goes back to the research that I mentioned before. If we can recognize the signs early, these might include irritability, sleeping problems, then we'll know what to do about them instead of dealing with them when you're in the flux of it, when you're overwhelmed. And then identify sources of stress. What is causing me to react this way? This is with everyone in life. Sources of stress might be that you have too much to do, family disagreements, feelings of inadequacy, or the inability to say no. But you have to identify those. I've identified those in my life. What causes me so much stress? Why am I feeling this way? People typically feel stress on Sunday night because of the work week coming up. So if you know that, what can you do? We first have to peel back the layer of recognizing what those stressors are. Identify what you can or cannot change. Try to change things over which you have no control. You all know who are listening to this. You only become more frustrated. What do I have control over? Can I change? What don't I have control over? And then take action. Some of the smallest actions to reduce it will work for you. Just one action. They know that even if you do one thing for yourself, that will increase self-resilience. It will increase self-efficacy if you can do just the one thing. And then celebrate that one thing. Setting goals, taking a break from caregiving, easier said than done. Getting help with caregiving tasks or engaging in activities that really make you feel good and healthy. If they're too big, you need to break them down into a smaller task. What steps do I need to take to reach this goal? And then seeking solutions is identifying the problem. Look at the situation with an open mind. You think the problem is you're really tired all the time? No one cares for my loved one like I can care for them. Thinking you have to do everything yourself, and then list the possible solutions. Try to get, even though someone else provides help to my loved one in a different way than I do, it can be just as good. And this was really, in my own life, was difficult. Having somebody else come in and give help for my son, when I knew all of his idiosyncrasies, and all of his nonverbal, that he was telling a message. And those small idiosyncrasies or nonverbals are what it's really very difficult to teach somebody else who's coming in to help you. Also, the guilt of causing your child more pain if somebody else was coming in is huge. But you need to select one of these solutions, try it and evaluate it. Doesn't work, get another solution. If the first idea didn't work, then select another one, but don't give up. Just don't give up. Keep fine-tuning it, because you'll get it. Use other resources, too. And then maybe that one didn't work at that time, but down the road, maybe a year later, that solution will work. And so maybe even keep a running log of some of the solutions and then come back to them at another time. Number 4, tool 4 is communicating constructively. Use I messages. I am angry. I am tired. I am exhausted. I am happy. Not, you made me angry. You made me frustrated. We have to respect the rights and feelings of others. But also when we talk, and I think this is critical, I'm a huge advocate of training people how to communicate constructively, to be clear and specific, because it's empowering. It changes laws. It gets things that you need. You need to speak directly to the person. Don't hint or think that they know what you're talking about. Speak directly about what you need. And if they don't agree with you or they can't help you at that time, that's okay. My mom said just last week, the number one important body part that you have is your ear. Be a good listener. Listening is the most important aspect of communication. But when you communicate, you have to be assertive, constructive, know that you need to be heard, and know that you need the support. Tool 5, asking for and accepting help, which is difficult. When people have asked if they can be help to you, you often say, thank you, but I'm fine. How many of us have done that? Raise your hand in the air. I can't see you, but I'm raising my hand. Many caregivers don't know how to marshal the goodwill of others. And you may not wish to burden other people, or it's kind of a hassle, or how can I ask them? Be prepared with a mental list, though. So if someone says, how can I help you? Say, I need 15 minutes of your time a couple times a week. If the neighbor's going to the grocery store, say, hey, can you pick me up some eggs or something? If somebody is good at looking at insurance papers, then have them look at the insurance papers and say, let me have a look at those. Maybe a fresh eye will help. Help can come from the community resources, family, friends, or professionals. Ask them. Don't wait until you're overwhelmed or totally exhausted. It's a sign of personal strength if you do ask for help. Tool 6 is talking to the physician. We know that physicians are very under a lot of scrutiny right now. So you only have 20 minutes for a follow-up visit or 40 minutes for a follow-up visit. And by the time they get through with all of the allergies and everything else, they only have maybe like 5 minutes. But you have to rally around and make sure that if you do not get your questions answered, that you have a way that they can get answered. So if you come in with a list of questions and they don't get answered, you need to say, how can I get these questions answered? Can I email you the questions? Can I solicit your nurse for the questions? Do you have a case manager that I can field these questions to? 77% of those caregivers reported need to ask for advice about medications and medical treatments. The person they usually turn to is their physician. And so physicians are very important. Caregivers will discuss their loved one's care with the physician. Caregivers seldom talk about their own health, and they seldom go in to get themselves checked out. You need to really build that partnership. If it doesn't happen, sometimes you may want to change and build a team that is very supportive. And then prepare your questions ahead. Make a list. And I've often said this, that just have a tape recorder or something, push it, write your list down, and then have somebody organize them for you. A lot of times when you go into the doctor, make sure that your needs are met. If it's the first appointment, and I've said this before, that go in and say, for whom am I speaking to? Because a lot of times you'll be speaking to the first-year resident, third-year resident, you'll be speaking to an intern, and then finally maybe the doctor who really can do something will come in. So if you don't have that time, say, I'd love to train. I am in a training hospital, but at this time, my son isn't feeling well. I just need to see the physician at this time. Call ahead to make sure that they're on time. And take someone with you. A companion can ask questions or they can listen in. And use that assertive communication, iMessages. Enlist the medical care team as partners in care. Present what you need, what your concerns are, and how the doctor and nurse can help and how they can get back to you. I think the medical portals have helped a great deal. Tool number 7, learning from our emotions. So our emotions, really listen to what your emotions are telling you. And ask yourself, why am I feeling this way? What has triggered it? And then if those emotions overshadow the joy of living in the present moment, then that's when individual and family therapy can really help you to look at those emotions and say, why am I feeling this way? Again, I can't stress this enough, that caregivers are at high risk for depression and stress-related illnesses, anxiety as well. So therapy, one of the things for anxiety disorders is well-researched. The number one therapy is cognitive behavioral therapy. You learn to identify situations that make you anxious. So what if it's making you anxious to go to clinic today? What can you do to help rethink those? They're called cognitive reframing. And to reduce your feelings of anxiety at those times, come up with different mental strategies. That's what CBT does. Also works with depression and coping and things like that. Cognitive behavioral therapy range from 60 to 90% success rate in a very short time. 3 areas of assistance are information, respite, and support. This is something that we can train the new parents coming up. Feeding, bathing, grooming, and dressing, handling toileting and other transfers, handle a complicated medication schedule, the needs for now and in the future, physical limitations that care receiver has now will have, financial situations, and insurance needs. I'm an advocate and you're an advocate for one another, and this is the type of information that we all need. Respite. It's not easy to take a break. Not easy to leave your loved ones because something might happen. You feel guilty. A break from caregiving can give you years. It's necessary to take care of yourself. And then you can't do this alone, and you're not alone. Please, the listener audience, you're not alone. I am here. People at PPMD are here. Everybody's here for you. And the longer sometimes you caregive, the more isolated you become. Reach out. One reason caregivers don't get help in taking care of themselves is it's just one more thing to do, man. One more thing that I have to put on my list is to take care of myself. But it's very, very important, critical that you do. The key is caring for yourself. You can't be perfect. You have a right to all your emotions. You own them. Set realistic expectations for yourself and your loved ones. Learn to say no to things you cannot do. Learn to accept help from others. Identify your button pushers and stressors. Identify your coping skills. Coping involves eating right, exercising, and sleep. Look for the positives, like cognitive reframing. I'd like to leave you with this quote. It says, when the world says give up, hope whispers, try it one more time. Just try it one more time. You're not alone. You're not alone out there. We're all here for you. Here are some resources that have been put together. It's not exhaustive. It's just some of the resources. Please take a look at those. See if something will be useful for you. And finally, before we open it to questions, knowing how a child's chronic condition affects you will help you to know when to ask or seek support or ask for help. Talk to your doctor if you're feeling like you're becoming overwhelmed. Please don't be afraid to speak openly and honestly about the way you're feeling. Reach out to others. I've put numbers in for you for helpline, can offer you support and provide information and resources in your specific community. They'll also give you help and support and encouragement. The American Psychological Association has a help center as well. They have resources, information that can help you at www.apa.org. And then Mental Health America provides a quick assessment and also resources. That's how I'd like to end it, but I want you to know that you're not alone. We're all here for you. Caring for the caregiver is extraordinarily important, and it's now open to questions. Thank you.
Kendra, thank you. That was really fabulous. Thank you so much. Could you talk a little bit about the impact of financial burden on well-being? So many of these diseases and chronic illnesses carry with them a tremendous financial burden that families are trying to manage. So could you talk a little bit about that?
Yes, it's not only just the financial burden of having a complex medical child, but it's also a financial burden of the sign of our time. So with everything that's going on and prices going up, it is probably, when you look at all studies put together, and I'm talking about all rare genetic diseases and all the studies that I've been on, socioeconomic status comes up as number one. And so that even adds to, like you said, the burden. There are resources. There are associations that people who have children with Duchenne or Becker can reach out to. There are resources where if you needed to try something out, or you needed a wheelchair, or you needed something that would make your life easier, they can get that for you. So there's resource lists on PPMD, and then in this particular state, there's PACER Center, so PACER Center. It's located here in Minneapolis, but they do reach out nationally where they have all sorts of resources. Also, for monetary resources, there are some associations that will, help you through that as well. But again, you have to ask for some of that help, and a lot of people just don't want to. But it is not only for the quality of life for you as parents, but it's also for the quality of life for the children. And I don't know if people know where to get that help, but we can put that up there as well too.
That would be really helpful. Thanks. Like Kendra said, there's a website, we have a page on the PPMD website for state-specific resources, but it's a living document. So if people on the webinar have resources that you'd like to add to that list, please let us know, and we'd love to add both national and state-specific resources for the benefit of everyone who uses that page. So thanks. A lot of people are on social media. We have so many groups online, and there are groups for moms and groups for young men and groups for everything that you can think of. Could you talk to us a little bit about the role of social media in social isolation and helping to build resilience?
Well, so there's two questions there. One was about social media. Social media is good because it does connect people in the 21st century. Social media is outstanding to get support, to give suggestions, to be encouraging. But like everything else, it's complex. And so you have to do your own research. You have to believe but validate what other people are saying as well. So I think that's very critical that you build your self-confidence and your resiliency and your self-efficacy based on your successes and what you have learned and what you can take control of, and not by maybe other people and some naysayers. And I don't know how to say that in any other way, but sometimes you can go online and you can, there's a lot of negative, but there's more positive. But, coming from Colorado and some of the northern Minnesota folks and being born and raised in Montana, it's very isolated. There's few and far between. So social media is very important to get, to take care of some of that loneliness and feeling like you're the only one in the world. What was the other question? I'm sorry.
Well, no, just the role of social media and trying to mitigate social isolation and the need for information. But I just want to stress what you said as well. It's really important to validate the information that you get on social media to make sure that it's what you need and it's something that's useful. There was a question or a comment about where to get support, and I think people tend to think about getting support in traditional places like support groups or through medical modalities, but just to mention that there are lots and lots of places to get support, through churches, through friends, through respite groups, through mom groups, through PPMD Connect groups. But Kendra, you're right, you have to ask for it, right?
You have to ask for it, but also you have to begin somewhere. And so maybe, a mom support group would be where you began. Sometimes if you are part of a clinic, the social worker in the clinic has oodles of resources where you can get help or get connected. Many of the smaller and larger congregations and churches do have support groups specifically for caregivers. Now, it's typically for Alzheimer's, but there have been some that are for chronic conditions as well. So there's many places that you can go, but instead of overwhelming your thoughts with where do I go, just pick just one so that you're not overwhelmed, and then just go to that one. And if it's not the right one, like I said, put it aside, maybe come back to that one a year later and go to another one. If you type in just respite, or you type in, American Psychological Association, where can I go in my state? PPMD also has that as well. You can go in and find out just in your state. Ask a neighbor. Don't even build your wall maybe around just Duchenne, but reach out to maybe another group and ask that group, of chronic conditions, where do you go for help? Where do you go for support?
Thank you. I think that's a great place to end. If those on the phone need help or are looking for support, please make sure that you reach out, and we'll make sure that we connect you. Kendra, I can't thank you enough for this presentation. It's been wonderful. For all of you online, this webinar has been recorded, and the slides as well as the recording will be archived and available for you to refer back to. So again, thank you so much, Kendra, and if you have any final statements that you want to make.
I just want you to know that you're not alone. There's a lot of help. There's a lot of people that care about you. There's, we're all connected in some way. And I'm here for you. And don't get discouraged. Just keep on. And just take a deep breath and we'll get through this. Thank you.
Thank you so much. Thanks for everybody for listening, and this concludes this webinar.